I think the take home from Framingham is that cardiovascular disease is a multifactorial process. It's not just cholesterol that leads to heart disease, but it's cholesterol plus your blood pressure, plus your blood sugar, plus smoking and diabetes and all these different things. But yet, how we communicate this to patients has been kind of difficult because I think patients tend to think of risk factors as normal and not normal. With cholesterol, my cholesterol is normal, therefore it doesn't cause any risk. And yet we know very clearly that these are kind of a linear relationship between cholesterol and coronary heart disease. And so I'm wondering your thoughts on the idea of having a normal risk factor when in fact it comes with some degree of risk. If everybody smoked in the U.S., smoking would be normal. That doesn't mean that it's healthy. And so how do we communicate that to patients?
Yeah, well, it's not only patients who have some misconception about that. It's journals and physicians and so forth. And I actually wrote an editorial about this.
I was thinking that. I think I came across that.
Yeah, I wrote an editorial about this recently because, again, it's sort of the headlines can mislead people, and then you get patients asking you questions about things that had really been miscommunicated. So there was a paper recently in one of the cardiology journals talking about normal LDL, and when I read the paper, they were talking about normal as being like LDL 130 or something like this. And I think we need to distinguish between what's a treatment goal and what's normal. And exactly the issue that you're bringing up, sort of anywhere on the spectrum, people can be at kind of somewhat increasing risk. And yes, we can easily identify people who are really at the extremes, and we say those people are really high risk. But even at levels that would appear to be low-ish, they're probably not really totally normal.
Right.
Not totally normal. So, I think if we start to think of like LDL below 70, for example, as normal, that's very different than saying, an LDL that's treatable.